College and Mumbai, batch of 2023. He's an author of several chapters in PG books and has 16 publications to his name. He's a teaching enthusiast intending to bring back OBGY on the same page of enthusiasm as medicine and surgery for MBBS students. We are truly fortunate to have Sir with us to kick off this exciting series. Thank you for taking your time to share your valuable insights with us. I would request Khushi to take over and introduce the organization.
Thank you, Malika, for the opportunity. I would like to thank one and all present here for joining this session today. And also thank you so much, sir, for taking out time from your busy schedule and we are really happy to have you with us today. We would all like to welcome you to the first All India OBGYN Student Society, proudly established on International Women's Day 2024. At SIMSOG, we are a passionate community united by our dedication to women's health. Our mission is to create a dynamic platform for medical exchange among students and clinicians, fostering growth, learning, and collaboration. Our tagline, Breaking Boundaries, Building Hope, reflects our unwavering commitment to advancing women's healthcare through knowledge sharing, advocacy, and innovation. We are proud to share that we have successfully conducted impactful events recently, such as live discussion on gender-based violence, addressing critical issues affecting women globally, Academia Aeternum, which was a 12-week research workshop series aimed at enhancing research skills. We also had a webinar on the USMLE residency pathway into OBGYN and career pathways in OBGYN, offering guidance for aspiring professionals. Also, an on-ground camp on fetal presentation, providing hands-on experience in clinical assessment techniques. But that's not all. We have many exciting events lined up for you, including panel discussion on female genital cutting in collaboration with Equality Now, which is scheduled for tomorrow, that is 19th December. Please do not miss this critical conversation and do sign up today. A reel making competition series, Guess the Diagnosis in 60 Seconds. We are having that lined up in January, so details would be posted soon. We have also regular research journal clubs to discuss groundbreaking studies and upcoming research project opportunities for those looking to dive deeper into academic work. Stay tuned to our Instagram page for updates and announcements about these and other future initiatives. We welcome all undergraduate and postgraduate medical and allied students to join us. Membership is completely free, and as a member, you'll gain access to incredible opportunities for networking, learning, and professional growth. Find the general membership sign-up link in the chat box and join us today. Let's continue to push boundaries and create a bright future for women's healthcare together. Wishing you an enlightening session ahead. Malika, over to you, and sir, we can now continue. Thank you.
Thank you,
Shall
Khushi.
I begin?
Yes, sir. You may start.
Okay, Malika and Khushi, first of all, thank you so much for the introduction. Before I begin, I would like to state that this society that you all have made, I just got to know about it a couple of weeks back, and it really makes me feel very proud of you all, and also makes me very happy over the fact that undergraduates, it's a body that I've seen is purely managed more so by the undergraduates all over India. And for OBGYN to have such a society, I mean, if I'm going to quote, not really quote, but if I'm going to quote the minds of every MBBS student, most of the students find subjects like medicine and surgery to be very glamorous and sexy. And OBGYN is often a subject that gets left behind despite it carrying equal weight of final year exams and it being an equivalent clinical subject as well for residency and beyond. So the fact that you all have made this initiative and you all are taking it so well ahead. I've seen your Instagram page and it has amazing people. You all are following amazing people. There are amazing things that you all are doing. It really makes me feel proud and very happy that even the grassroots level, I believe MBBS is the grassroots level for OBGYN is thriving and you all are making OBGYN great again. So thank you so much, not just for inviting me, but for carrying this initiative ahead so well. And I would like to wish you all the best. And with that, let us begin our session today. Should we?
Can we have a quick poll just to know which year of participants we have?
Yeah, absolutely. We can. I'll just share my
Yeah,
screen until then. Please do have a poll. If anyone can just put up the poll.
yeah, I'll be posting the poll now.
Okay.
Participants can just vote and let us know which year you are so we can cater adequately.
Participants are requested to open the chat box and go to the activities tab where you will find the poll. So please vote in that. And in the meanwhile, sir, it's okay if you begin with your presentation and speaking so that the poll can go along
Okay, it can go along
alongside.
simultaneously. Okay, works. Fantastic. Fine. So before I begin, uh, I would like to just, rather than directly bombarding you with the way that an examination is to be written, what is the agenda and what is my intention over the next 2 days, today and tomorrow, is first of all, how to formulate an answer. Now, I understand that especially at the level of MBBS, for people who are doing the residency, there are a few people who are awaiting their residency exams and they are attending it. But more so for the MBBS students, they have a lot of exams to write in the final year. Um, so when I say that I'm going to teach a methodology, I do understand that the methodology that I teach should be something that can even conform to other subjects so that it not only helps you write answers in OBGYN, but it can also help you formulate an answer accordingly in the other subjects. So the kind of format that I have made today is something that can help you write answers, but it is more curated towards OBGYN. That is the only thing. So today I'm going to teach you all, or I'm going to be telling you all, first of all, how to write a paper. Following that, it is not only the methodology, but also working on the psyche of the examiner. What do I mean by working on the psyche? There are a few aspects that I'll mention. Now, first of all, as I mentioned, as it was mentioned earlier, I'm from batch of 2023. So I've given my MS exams as recent as just last year in the month of June. Until then, I was a student just like y'all, and I was someone who was just writing exams. But since then, since I've taken the post of assistant professor and senior residency, I've been correcting papers as well. And gradually, I have picked up the brains of a lot of senior faculties. And even my own experience of correcting papers, I've realized a few things from the other side now. Y'all are on the other side, whereas I am now on the other side. That when we are correcting papers, there are a few things that we tend to notice, and there are a few things that we tend to not notice. So, what is it that would make me like your paper more? And I'll be very honest with a lot of things today with regards to paper writing, as to how an examiner views this task of correction of papers. And with that, I'll tell you all how do we proceed. Before proceeding, I would like to quote Harsha Bogle. So, by the way, I happen to be a great cricket fan, a cricket fanatic, I'd say. Yes, even on the day of NEET PG, a day prior to that NEET MHCET, it was CET during our undergraduation. All these exams, I've been watching matches and everything. So he once mentioned, I mean, बहुत बार हम सुनते हैं, a little bit of Hindi is okay, I guess, I hope. So um, people often say कि यार उसका नसीब अच्छा था. He was very fortunate enough that he could get that in his life. Or people tend to put a lot of things on luck and they tend to victimize themselves. They often say उसका नसीब अच्छा था कि उसको practical exam में ये case मिला, and he was lucky enough that he got that examiner. He was lucky that he didn't get my share of bad luck in the exams, or it was my poor luck that all the questions came which I had not studied from. This is from the point of view of exams. In every stage of life, we can blame things on our poor luck, bad luck. But what actually is luck, and is it really luck? And should we be at the disposal, or should we be at the, what do I say, कि सिर्फ luck पे भरोसे रहना कि हुआ तो ठीक नहीं तो नहीं? Not really. So Harsha Bhugle had once said that luck is about being ready when the opportunity presents itself. So whenever the opportunity is presenting to you, if you're ready to grasp that opportunity and make the most out of it, that is what luck is. So I am pretty sure, and I can say that with a lot of assertion, that everyone has been presented with a lot of opportunities. The problem is, do we And do all of us recognize that opportunity? Do all of us do that? And unfortunately, we don't. So the first question is, how do we recognize opportunities? And the only way to recognize opportunities is through hard luck. You often see those class toppers in your class who are answering everything. एंड एग्जाम में भी यू फील कि उनको ही इजी केस कैसे आ गया, उसने तो बहुत अच्छे से आंसर कर दिया, उसको बहुत ही ऐसा कॉमन अनीमिया का केस कैसे आ गया. Is it really luck? Not really. It is that they have been working behind the closed doors when no one's noticing, and they have been doing the same case again and again. They have been writing the same answer again and again, probably 10 times, 20 times. They have been just revising through it again and again and again. Even a lot of our teachers on online teaching platforms like Marrow, Prepladder, Cerebellum, they all tend to say that revision is the key to cracking all those competitive exams, to doing well in exams. Why do we focus so much on revision? The point is, revision is what that hard work is, which is going to help you convert those opportunities and make yourself a lot more luckful or have lot more luck than others. So the next month or so until your exams, your final year exams are there, or for whichever exams you all are preparing for, be it your entrance, be it your final year university exams, remember that the efforts that you put right now in the next month when no one is noticing are going to reflect directly when you go for your exams. You will have all the luck on your side if you are able to recognize the opportunity that you have right now. That opportunity is not going to be created a day prior. At the end of the session, I'm going to be giving you all a few questions that are very important, that have a higher chance of occurring or coming in the exams. Merely relying on that, merely relying on just the previous year questions are important while मैं पढ़ के जाऊंगा, that is never going to fetch you that share of luck. You are going to just perform as a mediocre person. Try to understand the subject, try to love the subject, and that love is not inculcated within a night. That breakthrough that doesn't occur in a night, it takes months, it takes weeks. You have that period right now. So I hope you all put in the hard work, and I believe everyone will have the luck on your side. So that's it about philosophy. Let me just get ahead with the session today. So whenever you start writing a paper and you're done with your paper writing, remember your paper is literally like a gift. Your paper that you have written is literally like a gift. It's a gift which you're giving to someone. The someone here tends to be the examiner. And the first thing that the examiner is going to notice, or the first thing that any person who gets any gift notices, is going to be the gift wrapping. बाहर से कैसा लिखा है? The intention that I wish to convey over here is that your presentation, how does it look? The first look of your paper is going to give you a different kind of head start over your other colleagues who have had a very poor paper presentation. So what do I intend to see by this gift wrapping? ये कौन सा पार्ट है? ये तो बस दिखा हुआ है. गिफ्ट रैपिंग तो वो होता है जो फर्स्ट इंप्रेशन छोड़ जाता है. वो गिफ्ट रैप खुलने के बाद वो गिफ्ट रैपर तो कचरे में जाता है, अंदर का कंटेंट है वो मैटर करता है. बट दैट गिफ्ट रैपिंग जस्ट गिव्स यू एन आइडिया कि यार यार इसके अंदर कुछ तो मस्त रहेगा. So during exams or your paper, what is that important gift wrap that would impress your examiner first up? This happens to be your presentation. And when I say presentation, I intend to say a few things. First of all, when you get your paper, try drawing those margins if there are none. Spacing, at least on the first 2-3 pages of your exam paper, give adequate spacing. Don't just crowd up your entire page with your answers. Remember, from the point of view of an examiner, remember that examiners are not well paid for this correction. And a lot of times for papers like preliminary exams and all, they are not even paid, not even a single rupee. And for those university papers, the payment is extremely poor. Now imagine you as an examiner, instead of being a student, you are an examiner and you have a bundle of 30 papers that you have to correct every day. For those correction, university papers are corrected in a specific room. You can't take them home. There are certain protocols that are followed. एक room में तुम्हें ऐसा 30 papers रोज दिया जाता है. Every paper in that 30 ka bundle has 30 pages. So in a day, you have to correct somewhere between 850-900 pages. It is humanly impossible for anyone to be correcting these many number of pages every day. Every day छोड़ो, एक दिन भी अगर करना होगा, it is impossible. for any human person to read it, कितना भी उसको प्यार हो उसके job से, I might be the most passionate person about teaching and correction and everything, but still it would just frustrate me beyond a point, especially when there is no incentive. Incentive क्यों नहीं है? I have to manage my clinical ward work, being a clinician, and then I have to come and do this work in the hospital, in the college. So I have to remember that there will be a few things that will set your paper apart from the rest of the people, and the fact that not everyone does it in a batch of, let's say, 100 or 200 people, not everyone does it. So if you do it, your paper is going to be set apart, and that will give the examiner an idea of how your paper is probably going to be. That judgment that your examiner gets is going to be through these things. सो फर्स्ट ऑफ ऑल मार्जिन्स करो, अच्छे से स्पेसिंग करो. पूरे पेपर में स्पेसिंग नहीं करोगे तो भी चलेगा, एटलीस्ट पहले आंसर में करो. जो फर्स्ट चीज पड़ेगा, फर्स्ट पेज पड़ेगा एग्जामिनर तुम्हारा, उसमें अच्छा प्रेजेंटेशन रखो. उसमें गिव अ प्रॉपर टाइटल टू एवरीथिंग दैट यू राइट. टाइटल के नीचे सब टाइटल्स दे दो. ये सबके साथ अंडरलाइन करो, बॉक्सेस बनाओ, पेंसिल से बनाओ, जो भी रूल्स है वो फॉलो करो, बट मेक इट मोर अट्रैक्टिव. So इससे क्या होगा? Now remember that first judgment that is going to be done for your paper is going to be excellent. And what do I mean by judgment? Now remember, every person is judgmental. लोग कहते हैं यार तू तो बहुत बड़ा judgmental इंसान है. नहीं यार, everyone is judgmental. It is just that a few people do not verbally express it. They are not that opinionated. Everyone has their own judgment about everything though. Similarly, your examiner will have a judgment about your paper by seeing the very first page or very first answer. So remember, your first question, or rather your first answer, is always going to set a tone for your entire paper. It sets the tone. If you're writing some random nonsense on the first answer itself, you go and attempt some question and you write all nonsensical things, active, passive was, इधर उधर बस line को आगे पीछे किया है, that is not going to help your case. Your examiner will know that ये बंदे का पेपर तो पूरी तरह से खराब होगा. On the first page itself is going to be very poor. Your examiner has no business absolutely to give you a second chance. Once your first answer is looking very shabby, उसमें कुछ भी कचरा डाला हुआ है, there is no scientific thing that you have written, बस इधर उधर से कैसे तो recollect करके लिखा है, it won't make a difference even if your next answers are going to be perfect, if they are going to be amazingly written. So remember, your first answer is going to set the tone. So when I say that it is going to set the tone, how do I set the tone to be a good tone? How do I ensure that my examiner believes कि इसका पेपर में ऊपर ऊपर से भी अगर चेक करूंगा तो it is going to be enough? For that, I follow a 1-1-1 rule. Now, what is this 1-1-1 rule? 1 is the first answer that you write. The next one is the first line that you write in your first answer. And the last one is the first quote that you put. Now, what is this quote that I'm mentioning over here? You might think कि quoting भी कर रहे हैं क्या exam में? नहीं, just understand it's a very simple concept. Now remember that most of your examiners are people who are traditionalist, जिनके time पे ये marrow हो, cerebellum हो, all these dams हो, ये सब नहीं था. And the only standard books that they read, though the fact might be that you all are reading those reference books because they give much more information, they are easy to remember. Remember the fact that your examiner only reads or has read several years ago all the standard textbooks. Standard textbook for undergraduation happens to be Datta. Datta happens to be the standard textbook for OBS. कुछ लोग Holland and Brews भी पढ़ते हैं, but Datta stands Indian scenario के लिए it's a good book for OBS. And for Gynae, it can be either Shaw or Datta. These are the standard books that they have read. For postgraduate students, it can be Williams and Novak and Berwick. So OBS के लिए it will be Williams and Oxon foot अगर रहेगा लेबर के लिए. And for Gynae, it is going to be Novak and Berwick. या फिर आजकल का कोई नया इंसान रहेगा तो Williams Gynae का भी आ गया है. These are going to be the standard books that your examiners have read, and they have read that book over and over again on multiple occasions for multiple reasons. So उनके दिमाग में जो भी definitions होते हैं that are given by the textbooks, and all the textbooks, these standard textbooks will always give you the official definitions that are given by official authoritative bodies. What are the authoritative bodies that I intend to say over here? Places like WHO हो सकता है, या फिर ACOG हो सकता है, अमेरिकन कॉलेज ऑफ ऑब्स्टेट्रिशियंस एंड गायनेकोलॉजिस्ट, या फिर RCOG हो सकता है, रॉयल कॉलेज ऑफ ऑब्स्टेट्रिशियंस एंड गायनेकोलॉजिस्ट. दीज आर ऑल द अथॉरिटेटिव बॉडीज विच मेक गाइडलाइंस, विच फॉर्मुलेट रिकमेंडेशंस. तो ये जो बॉडीज के डेफिनेशन है, ये तुम्हारे टेक्स्ट बुक में हमेशा दिए रहेंगे. द टेक्स्ट बुक विल नेवर गिव इट्स ओन लैंग्वेज, इट विल नेवर हैव इट्स ओन way of saying things, because even those textbooks have to quote someone and they can only quote evidence, and the evidence is always provided by these three bodies. So remember, whenever you get any question, assume that your first question that you're attempting is pre-eclampsia. Pre-eclampsia का जो पहला आंसर है तुम्हारा, first answer that is your pre-eclampsia में, the first line that you will be putting is going to be the definition, and that definition should not be something that you're making of your own. बहुत बार लोग ऐसा ये बोल देते हैं, they just write a definition BP of more than 140/90 in a pregnant female. अरे how is this preeclampsia? This doesn't even form preeclampsia. A few people just add कि with proteinuria. अरे this is a very informal way of saying things. It's a good way to remember what preeclampsia is, but it's not a good way to write what preeclampsia is. The actual definition says that it's a complex syndrome in which the blood pressure of a pregnant female, especially after 20 weeks, if is more than 140 systolic blood pressure millimeters of mercury, or 90, or not and, or 90 millimeters of mercury of diastolic pressure, along with proteinuria, and that has to be measured 4 hours apart twice. This is the scientific definition. This is just an example that I've given you. This is how you have to write, because this is how it is given in these textbooks. Now you would say कि इसके लिए हम अभी textbooks पढ़ना शुरू करें. If you have not read already, ideally you should be reading these textbooks for your final exams. But if you have not read, at least read the definitions and go. Those definitions are going to play a big part in making the first line of your answer perfect. The moment you put this as your first line, उसको अच्छे से underline किया, quote के अंदर डाला, your examiner will know that you have read everything from standard textbook. You have literally quoted the definition as and how it was given in the textbook. That sets the tone. The examiner knows कि तुमने सब पढ़ा है. अगर वो definition इतना याद है तो तुम्हें सब बाकी का पता होगा ही. वो ऐसा assume कर लेता है, मान लो मेरी बात. Obviously थोड़ा बहुत आगे पढ़ेगा वो, but इतना डिटेल से बारीकी से नहीं पढ़ेगा. The intricacies are not going to be focused as much on. This is your first battle that is won. Your entire paper has been given a good tone. You have gotten a good head start, and the examiner is going to blindly start thinking कि अच्छा ये इसने ऐसा लिखा है तो अच्छा ही होगा. Similarly, for every answer that you initiate, your first line of definition, if is from these standard textbooks, the standard definition, just one line of definition from the book, the examiner knows that you have read everything. बाकी का आंसर वो आराम से पढ़ेगा और तुम्हें अच्छे मार्क्स देने ही वाला है. So remember, your first answer में 1-1-1 का rule, that your first answer का first line should be a definition, and that should be a quote. The first thing that you do is quote from one of these textbooks, and it's an easy thing to remember. It's not a difficult thing. एक line बस हर important topic से याद रखना है. So first of all, this is how your paper gets a good start. Well begun is work that is half done. What's next? The examiner has read your first line and he is impressed now, he or she is impressed now, and they believe that you might be onto something, who's a good student. You are a good student who's probably read everything. So they will just say मैं ऊपर ऊपर से आगे का चेक करता हूँ, मेरा फटाफट पेपर हो जाएगा. Everyone wants to go back home. They just want to get done with this checking of papers and they want to go back home and they want to rush through your papers. So give them a chance to rush through your papers. How do you give them a chance? Now, after reading your first line to be excellent, they will just try to find multiple keywords and values in your paper. They will just want to find keywords and values. तो ये जो keywords and values रहेंगे उसको हमेशा highlight करो, underline करो या box बनाओ. Now remember, कितना भी intelligent student हो, सबको ये बात एक पता है कि जितने ज्यादा पेपर भरेंगे हम, जितने ज्यादा हम लोग वॉल्यूम पेपर का बढ़ाएंगे, जितना लिखेंगे ज्यादा, उतना मार्क्स ज्यादा मिलता है. दैट इज अ टेंडेंसी दैट आई एग्री विद. एज अ एग्जामिनर आल्सो आई विल एग्री टू दैट कि जो ज्यादा लिखते हैं उनको हम एक आध मार्क्स ज्यादा दे देते हैं. बट दैट इज नॉट ऑल. अगर एक आंसर सिर्फ मेरे से 4 पेज का बन रहा है लेकिन मेरे को उसको 4.5-5 पेज करना है क्योंकि लॉन्ग आंसर है, सो व्हाट डू आई डू फॉर दैट? अ लॉट ऑफ पीपल एंड ऑलमोस्ट एवरी स्टूडेंट थोड़ा बहुत फेंकता है, एक्टिव पैसिव वॉइस इधर का उधर करता है, थोड़ा बहुत इधर उधर खींचातानी करता है, जस्ट टू इंक्रीज द वॉल्यूम. Now, when you do this, remember, do not do it on the first page itself. Do not do in the initial part itself. Initial part pe write everything that you know. Write the facts. First page pe just write the facts. फर्स्ट स्टेट ऑल द फैक्ट्स एंड उसके बाद में एंड में ये थोड़ा खींचातानी करो और ये फैक्ट्स में भी जो भी कीवर्ड्स एंड वैल्यूज रहेंगे उसको मार्क करो. When you mark it, you ensure that the examiner is only focusing on the keywords and values and the examiner starts thinking ये बंदे ने जो भी important points उसको लगता है वो already mark किए हैं तो मैं बाकी का थोड़ा छोड़ सकता हूँ. I won't read everything else. So basically you are kind of fooling the examiner into just reading the parts that you want them to read. So even if you might have read just 2 pages, लिखने जितना, but you have written 4 pages, ensure कि वो जो 2 pages तुमने factually बराबर लिखे हुए जिसमें कुछ भी फेंका नहीं है, उसमें you maximize the number of keywords and values that you have written and you underline and quote them. उसको ये सब करोगे तो इनिशियल पार्ट में एग्जामिनर बोलेगा कि इसने तो सब लिख दिया है, इसको मार्क्स मेरे को पूरी तरह से देने हैं. ऑल द फेक एंड इधर उधर से खींचा हुआ पार्ट, एक्टिव पैसिव वर्ब जो भी किया हुआ है, यू कैन जस्ट skip it, and the examiner is also not going to care to read much because you have already highlighted the keywords and values. What do I mean by keywords? Keywords, like, again, if I'm going to take the example of preeclampsia, keywords, a keyword in it is going to be severe preeclampsia. So when I speak of severe preeclampsia, it indicates target organ damage. So highlight करो target organ damage. The examiner then will think, अच्छा इसको target organ damage पता है, but कौन से target organs है उसके नीचे, अगर immediately, don't let the examiner find those words that they want to look for in your paper. You write them immediately after that. Immediately fill it up. तो लिखो उसमें कि liver में the transaminases can be increased. Apart from that, if the transaminases are increased, then in the renal system, every single system is affected in preeclampsia. So in the renal system, you will have increased creatinine. Apart from increased creatinine, you would have, don't worry, I've just shut off my window. Increased creatinine hoga. Increased creatinine ke baad mein, if you're looking at the hematological side of things, so hematological side of things mein, you would have thrombocytopenia, hemolysis hoga peripheral smear pe. So just in a space of 4-5 lines, write all these individual systems and circle these points. You are done with your answer. You don't need to think of anything else. So always remember to cram up all your facts and the things that you have read properly from the book in the first couple of pages only, and highlight all those important things. That is going to help the examiner skip the part where you have faked a lot of points, where you have just repeated the earlier points. So that is one way. Next, I'm done writing all this. I start realizing that I'm not having enough of time. I shouldn't be giving this much of time. So you would think कि ये सब तो मैं अच्छे से कर रहा हूँ, but what about the time management का part? So taking a detour from this, just speaking a bit about time management. How I did the time management is something that I will tell you all. People can have different ideas about time management. Now remember, and this is a point that is something that I would want to focus on, especially for the residency students. In the residency, the maximum thing that you do, एक जो इंसान करता है रेसिडेंसी में, वो है एक साइड का राउंड डालता है एक पेशेंट का पेपर पे, या फिर एक हिस्ट्री डालता है विच इज ओनली 1 पेज का. So all the people who are into residency over a course of 3 years or 2 years, depending on whether they're doing a degree or diploma, they tend to forget how to write long pages, how to write 30-40 pages at a stretch. जिसके वजह से over a course of 3 years, MBBS में that is not the case because every year you are writing your university exams, but in degree you are not writing it for 3 years. So you tend to lose out on the practice to write a lot of things, and you end up getting your hand to ache a lot within an hour of writing when there is still a lot of paper that is left. And in that, you end up losing time management ka point. So first of all, time management ka principle is going to be to know कि कितने marks का paper है and कितने घंटे में करना है. Assume करो you are writing a paper that is of 100 marks over 3 hours. I would roughly understand that my peak maximum writing limit and thinking limit is going to be in the first hour and a half or hour case में रहने वाला है. So I would want to divide my 3 hours into 35 marks for the first hour, 35 marks for the second hour, and 30 marks ka hi in the last hour, because at the end of second hour and third hour, I'll be completely exhausted to think more. I'll be exhausted to write more. Mentally and physically मेरा exhaustion हुआ रहेगा. I can even make it 40, 40 and 20. Basically, I would try to cover 40 marks ka writing in the first hour, 40 in the second, and 20 in the third. What if you go the other way around? If you say कि मैं धीरे धीरे करूंगा, मैं MS धोनी का fan हूँ. MS धोनी was someone who, Indian captain of course, ex-Indian captain. He would always believe कि I will take the game till the last over. मैं last में 2-4 six मारूंगा और अपने को जीता दूंगा. If you try to become Mahendra Singh Dhoni, remember he was literally as cool, as calm as a cucumber, and it didn't affect him. हम MS धोनी नहीं है, हमारा उतना नसीब अच्छा नहीं है. If you go the other way around, wherein you say कि मैं initially slowly लिखूंगा लेकिन अच्छा लिखूंगा, एकदम मक्खन जैसा पेपर लिखूंगा, 20 मार्क्स ही मैंने पहले घंटे में लिखा, नेक्स्ट घंटे में मैंने 40 का लिखा, एंड लास्ट आवर के लिए आई हैव लेफ्ट 40. Remember, you all are not MS Dhoni, and it is very difficult to be him. In the last hour, if you're leaving a significant portion of the paper, anything more than 25% of the paper, in the last hour, you are, remember, you are exhausted physically, you are exhausted mentally. Also, there is anxiety that is increasing, knowing that there is a significant part of the paper that is still left to answer, and that anxiety is going to make you forget things. Your nervousness, jo aega, you're going to forget things, and eventually you will end up losing your crucial time. So always try to finish the major parts in the first 2 hours, and in the last hour or last 30 minutes, try to keep the minor part for it. It might so happen that you feel that the first two, three questions are things that you have read amazingly well. And imagine it's an LAQ of 10 marks, and you feel that you have read a lot of it and you can write pages and pages over it. याद रखो तुम लोग कितना भी लिखो, beyond the point you are never going to score more than 80% of the marks per question. तुम लोग 10 pages लिखो, 15 pages लिखो, 20 pages लिखो, the examiner probably is going to only give you 8 or 8.5 out of 10, कितना भी अच्छा लिखो. But while achieving these 8.5 marks, you have probably sacrificed your short answer question, which was maybe of 5 marks or 4 marks, and you ended up not attempting it at all. So for the sake of this 1.5 marks, you have completely let go of a 5 marks ka question, wherein you anyway never had a chance to score 10 out of 10. It is impossible that you score even a 9. So remember, every question ko attempt karna is more important than writing a few questions like textbook. तुम लोग टेक्स्ट बुक जैसा भी लिखो ना तो भी एग्जामिनर पूरा तुम लोग का आंसर पढ़ने नहीं वाला है. देन यू थिंक यार मैं इतना पढ़ के आया हूँ, आई हैव पोटेंशियल टू स्कोर वेल. How do I ensure that I'm scoring well? How do I ensure that इतना पढ़ के आया हूँ तो I shouldn't be wasting out on my read part? For that, you have to understand that the time that is being spent maximally is in sentence formulation. Whichever sentences you're making, it requires the use of articles, the, and everything, prepositions, conjunctions. ये सब तुम लोग यूज करते हो, एंड इसमें तुम लोग का टाइम बहुत जाता है. Sentence formation is something that takes a lot of your time. So remember, for things that you have read amazingly well, and even for things that you have not read well, you have a cheat code. The cheat code has two parts to it. The first cheat code is going to be make a flow chart. Flow chart gives you the liberty to skip sentence making. You just write an important point, you draw an arrow, you state the next point. लाइन बाय लाइन क्रोनोलॉजिकली लिखो, तुम्हारा पूरा आंसर एक पेज में आ जाएगा. इवन इट वुड ऑक्यूपाई योर एंटायर पेज विदाउट यू हैविंग टू राइट 20 लाइन्स, व्हिच वुड हैव अदरवाइज रिक्वायर्ड राइटिंग 20 sentences to fill that page, and it will convey the same significance, the same meaning. And even as an examiner, I would love reading a flowchart because it saves my time as well, plus conveys me the same thing that you would have conveyed with 20 lines, but I would have had to read 20 lines. इमेजिन करो तुमने 20 लाइन भरा है और वो 20 लाइन में मैंने ऐसे पॉइंट पे फोकस किया जो थोड़ा सा इनएक्यूरेट था, and I judged your entire page over it. Instead, just write a flow chart. Just make a flow chart. Flow chart से तुम्हारा टाइम बचेगा, सेंटेंस फॉर्मेशन का भी टाइम बचेगा, और पेजेस भी भर रहे हैं, तो वॉल्यूम भी पेपर का बढ़ रहा है. प्लस व्हेन यू मेक अ फ्लो चार्ट, the examiner understands that you understand the algorithms. Basically, you know as a clinician what to do next, because जो फ्लो चार्ट बना रहे ना, इट इज एज्यूम कि उनके दिमाग में एक मेंटल मैप बनते जा रहा है एज टू क्या करूंगा मैं ये पेशेंट के लिए नेक्स्ट. पहले मैंने पेशेंट का हिस्ट्री लिया, हिस्ट्री बाद एग्जामिनेशन देखा, मैंने एग्जामिनेशन में क्या क्या साइंस एंड सिम्टम्स मैंने कंफर्म किए, उसके बाद में मैंने इन्वेस्टिगेशन किया, इन्वेस्टिगेशन में आई डिड ब्लड एंड सीरम स्टडीज एंड आई आल्सो डिड इमेजिंग स्टडीज, एंड देन मैनेजमेंट में आई ईदर हैड कंजर्वेटिव, मेडिकल और सर्जिकल मैनेजमेंट. ऑल ऑफ दिस आई एम गोइंग टू बी टॉकिंग अबाउट एट द एंड ऑफ दिस सेशन. But basically, this algorithm is in my mind. It's a mental map, is what the examiner understands, and hence a flow chart is going to help you save time as well as score more marks. Along with those flow charts, make rough diagrams. मेरे को तुम लोग के बुक में कोई ऐसा आर्टिस्टिक डायग्राम नहीं देखना है. आई जस्ट नीड टू अंडरस्टैंड इफ यू अंडरस्टैंड द ओरिएंटेशन. इफ आई अंडरस्टैंड कि तुम लोग को पता है कि राउंड लिगामेंट फैलोपियन ट्यूब से आगे होता है, एंटीरियर होता है, whereas the ovarian ligament is slightly posterior to the fallopian tube. All I need to know whether you know the anatomy, whether you know the relation. I do not want to see a blue color का वहां से ओवेरियन वेन जा रहा है, या फिर एक रेड कलर का यूट्राइन जैसा कहाँ कहाँ से यूट्राइन आर्टरी आ रहा है. आई जस्ट नीड टू सी whether you know the orientation, because knowing the orientation is important and not having an amazingly good looking diagram. So flowchart and diagrams are literally your cheat code to saving time and scoring more, and also ensuring कि तुम्हारा आंसर बुकलेट पूरी की पूरी तरह से भर रहा है, कुछ खाली पेजेस बचेंगे ही नहीं. Plus, whenever you realize कि I'm just left with 5-10 minutes and I have an entire question to be answered, just ditch the idea of writing an elaborate answer. Just go for a flow chart में तुम जो भी लिखोगे वो एग्जामिनर ही बोलेगा अरे लास्ट आंसर है, इसने अटेम्प्ट किया है, जो सब मैं जानना चाहता था उसने फ्लो चार्ट में बता दिया है, मैं उसको जितना हो सके उतना अच्छा मार्क्स दे दूंगा. दैट इज हाउ एन एग्जामिनर थिंक्स एज वेल. वेयरएज इफ यू स्टार्ट राइटिंग एन आंसर, तुम्हें जितना आता था तुमने उतना आधा ही लिखा, आई विल स्टिल थिंक कि इसको सिर्फ आधा आता था, टाइम कम पड़ा इसलिए आधा लिखा नहीं है. आई वोंट गिव any marks for that. I will only give you marks for what you have written. Whereas if you make a flow chart, I would definitely give you more marks than your colleague who has written a half-cooked sentence में answer. Until this point, does anyone have any doubt? Is everyone understanding what I intend to say? I would just want to know in the chat section. This is the first point on how to work on the examiner's psychology, on the examiner's psyche that I have discussed. I want to know whether you all have understood everything that I've spoken until now. इसके बाद में I'm going to start the topic of answer making methodology as to how do you formulate answers in OBGYN. Has everyone understood this? Is everyone enjoying this session? Just within a minute, let me know in the chat section. I'm waiting for you all in the chat section. I would want to know your review, whether you all are understanding this. Great. So next is what is the most important part of this lecture today, of this session today, and that is answer making. Now, this answer making is what I'd earlier told you. It's a very common thing that you can use in either medicine as well, or surgery as well, or peds as well, or OB/GYN, as I'm going to discuss today. Obviously, it is going to be more centric on OB/GYN or centered on OB/GYN. It is going to be a lot more focused on OB/GYN, but it's the same pattern that you can use even for these other subjects. If you are reading this, you would know कि इसमें से OB/GYN का part क्या है और क्या नहीं है. It's a common format that you can follow for every single paper. So be it OBS or gynae, the OBS or gynae paper each, the major part of answer making is similar. It is just that mother and baby नहीं होता है in gynae. It is just the patient. It's just the mother का role that you have to explain. Fetus वाला part कुछ आएगा नहीं. So differently कुछ नहीं करना है. It is going to be fairly similar. So answer making में, what is the first thing that I believe is most important? The first thing that I believe is most important is your title. Now you would say कि ये क्या बता रहे हो? ये तो बहुत obvious सी बात है. नहीं है इतनी obvious सी बात. A lot of people, what do? They just write question 3A and they start writing the answer. Now the examiner doesn't always have the question paper in front of him. वो 2-4 पेपर के नीचे गया रहता है, डेस्क के नीचे रखा हुआ रहता है क्वेश्चन पेपर. बार बार क्वेश्चन पेपर निकालूंगा मैं, उसमें देखूंगा कि ये बाबा 3A किधर लिखा है. इट इज अ लिटिल फ्रस्ट्रेटिंग. प्लस इट गिव्स माय माइंड अ लिटिल ब्रेक एज एन एग्जामिनर टू just focus a little more on your paper, क्योंकि मेरा ये बीच में ब्रेक लग गया है. I wouldn't want that. So always remember that question 3A लिखा है, ठीक है. Obviously a lot of people क्या करते हैं, question 1 नहीं लिखते, पहले question 3 से start करते हैं because you know question 3 better. That's absolutely fine. I do not mind that as an examiner कि तुमने order बदला है. But what I do mind is if you're not writing ये किस चीज का question लिख रहे हो. अरे just write the name of the topic पहले. Things like anemia in pregnancy. ये इतना भी लिखोगे ना तो मुझे पता चलेगा कि क्वेश्चन किस चीज पे है. अगर उन्होंने दिया है कि अनीमिया इन प्रेगनेंसी एज एन LAQ, आई नीड यू टू राइट दी एटियोलॉजी क्या है, उसका क्लासिफिकेशन क्या है, उसके कॉम्प्लिकेशंस क्या है, एंड मैनेजमेंट क्या है. ये सब लिखो. Basically, just jot down the entire question in one line. Don't write the entire question. Just jot down in a very basic way कि मुझे क्या चाहिए, so that I don't need to as an examiner keep looking at the question paper, keep trying to find the question according to the number that you have written, and then also try to find कि ये कितने मार्क्स का रहेगा. यहाँ पे बस लिख दो ये LAQ है, so that I know as a matter of fact कि अच्छा ये 10 मार्क्स का ही होगा या फिर 8 मार्क्स का होगा depending on your university. And I would know कि ये topic है. I wouldn't even need to refer to the question paper even once, and that would keep me. It would just keep me concentrated only on your paper और फटाफट फटाफट मैं तुम्हारा पेपर निकाल दूंगा. Fine. So सबसे पहले मैंने उसका टाइटल लिखा. So title is the first important thing that you write. Once I'm done writing the title, the next thing that I'm looking for is what is the meaning of that title. And what, when I say what is the meaning of that title, I intend to say the definition. What is the definition of the thing that we have asked for? Remember, every single thing that is asked in your exam, it can be anything. It can be anemia, preeclampsia, pelvic organ prolapse, diabetes mellitus, gestational diabetes mellitus, RH isoimmunization. Every single thing will have a definition that is given in the textbooks. There cannot be a single topic that will be asked in your exam that will not carry a definition. Write a definition, and as I've mentioned, write an evidence-backed definition, which means जो तुम्हारे टेक्स्ट बुक में दिया गया है, which must be quoted from some authoritative body. Write the definition, write a very proper standard definition. Along with definition, if there is any name of criteria that is used to define, तो वो भी लिखो. So criteria भी mention करो. Criteria मतलब क्या? एक example है, अगर मुझे HELLP syndrome, HELLP, hemolysis, low platelets, and elevated liver enzymes, फॉर्म ऑफ सीवियर प्रीक्लैम्सिया. अगर हेल्थ सिंड्रोम लिखना है तो मुझे पता रहना चाहिए कि इसका डायग्नोस्टिक क्राइटेरिया का नाम है टेनेसी क्लासिफिकेशन, टेनेसी क्राइटेरिया, वेयर एज द क्लासिफिकेशन क्राइटेरिया इज मिसिसिपी. तो ये जो क्राइटेरिया है इसका भी नाम लिख दो ब्रैकेट में. डेफिनेशन एंड द नेम ऑफ द क्राइटेरिया दैट इज यूज्ड टू डिफाइन, that should be your second line immediately after your title. Next, in the third line, I would want a little bit of an intro. The length of the intro depends on whether it's a short answer question or a long answer question. Irrespective of that, introduction में what all do I have to write? Introduction में मुझे epidemiology mainly लिखना है. Epidemiology is something that you have read in your PSM, community medicine. Epidemiology में what all is important? Epidemiology में first thing that is going to be important is my demography. What is demography? Demography is basically कौन से एज ग्रुप की फीमेल है, कौन से रीजन की फीमेल है. बेसिकली इज देयर एन इलनेस दैट आई एम टॉकिंग अबाउट दैट इज मोर कॉमन इन दैट पर्टिकुलर रीजन. फॉर एग्जांपल, प्रीक्लैम्सिया, एशियंस आर मोर predisposed towards it. Black women, dark skin shades, all these women are more predisposed. Age, very young, that is adolescent women, and very elderly women, they are again predisposed to preeclampsia. Similarly for anemia, lesser age, because of their increasing body demands in adolescence, newly or new onset of menstruation, menarche that has happened, all these factors will contribute to anemia. So age का कोई लेना देना है कि नहीं, कोई रीजन से है उसके वजह से उनमें ज्यादा हो रहा है, if there is any relation, or if there is something like anemia में you are talking about sickle cell disease, you have to mention that there are a few pockets in our country. Like in Maharashtra, I know that as a matter of fact, in the area of Vidarbha, there is a higher chance of having beta thal trait and sickle cell anemia. So there are pockets, there are regions that will have a certain disease that is much more common than any other. Or the socio-economic status. I would know, as a matter of fact, genital tuberculosis is going to be much more common in women who are of the poor socioeconomic status because of crowding, overcrowding, poor immunity, poor hygiene, poor nutritional status. तो socio-economic status का कोई लेना देना है नहीं. या फिर obstetrics में, you know that women who are obese women से chronic hypertension ज्यादा होता है. Chronic hypertension predisposes to diabetes, and that will again predispose to preeclampsia. So socio-economic status, both upper and lower, का कोई लेना देना है कि नहीं. Apart from that, is there any discussion on consanguinity that is possible? Consanguinity is basically खुद के ही सगे में, has the female been married to any person in her own community, in her own relations? So all these things, these 4 points importantly are going to constitute your demographic details. One more point that you can mention is also going to be parity. Parity भी इसे mention कर सकते हैं. Next, in epidemiology, I'm going to be talking about causes, या फिर the other name can be etiology. Etiology बोलोगे तो बहुत ऐसे शाने लोग एग्जाम में वो भी लिख सकते हो, causes पे लिख सकते हो. So do you want to mention whether there are any causes to it, any particular reason that the female is having iron deficiency anemia? Iron deficiency anemia can be because of hookworm infestation. It can be because of hyperemesis gravidarum की वजह से the female has never taken iron supplementation, or she is from a lower socioeconomic status. So all these things, all these causes and etiology need to be stated in a few points. And when I talk of causes, I also need to know what are the reasons why this female is predisposed to something. Predisposed to मतलब risk factors क्या है? तो risk factors हर एक चीज का लिखना जरूरी है. So in my epidemiology, I have three important points I shall be stating. It includes my demographic details, my etiology, and the risk factors that I'm looking towards. These are the first three things that I'm writing. First, title, definition, and the introduction, which is basically the epidemiology. Now, I come whether there is any classification that has been advised by anybody. Classification कोई बताया है क्या? Like health syndrome में there is a Mississippi classification, या फिर any classification. The classification can be on the basis of two things, on the basis of type and on the basis of severity. So write whether there is any classification that is given for the classification of the disease. Next, the most important point of your answer, that is going to be your pathophysiology. Now over here, your actual clinical answer begins. Remember, pathophysiology has two different words that are hidden in it, and those two different words definitely merit individual attention. You have patho, you have physiology. Why do I say this obvious point? Always remember that normal physiology क्या होता है, normal development क्या होता है, ये पहले लिखना जरूरी है. Normal जो है वो पहले लिखो आंसर में. Like in preeclampsia, when you say that a female who does not have preeclampsia, in her the trophoblastic invasion is going to occur normally, and the endothelium to epithelial transition that occurs is going to occur normally in a woman, in a female, whereas in a female with preeclampsia, there is going to be a problem in this very part. So physiology पहले लिखो, what is normal पहले लिखो, and then go ahead and write the pathological part, that is basically your abnormal part. When you write this normal and abnormal, that is when I would know why that deviation has occurred and what has that deviation done to the female. So pathophysiology में पहले physiology, that is the normal part, followed by the abnormal part. Next, pathophysiology तो अंदर हो गया. How does a female come to me with? So when I talk of the female coming to me, the next point in your answer is going to be your clinical features. What do I mean by the clinical features? There are two types. It can either be symptoms that a female herself has been experiencing, and signs that I, as a clinician, as an obstetrician, or as a gynecologist, that is the feature that I am going to elicit in her. Now, an important point of discussion over here, clinical features कैसे डिजाइन करने हैं या फिर कैसे डिफाइन करने हैं. In obstetrics, remember, I have two important people that are involved in every single disorder. One is my mother, that is the patient herself, and the other one is the fetus. Now remember, for every single obstetric answer, जब भी तुम लोग clinical features का बात करोगे, do not forget this point. Always remember, it is a very obvious part that she is pregnant and there's a fetus inside her, but we tend to forget the individuality of these two organisms. We are two different organisms who are having different complications, different symptoms and signs. खुद के अलग-अलग signs है. So mother and fetus का हमेशा अलग से लिखो. It also gives your answer a very nice refined look. उसमें भी अगर और अच्छा आंसर करना है, so when I talk of the mother, there are various phases that I want to divide her pregnancy into. There are 6 phases. Remember, 6 phases में पहले आता है pre-conceptional. So pre-conceptional कोई significance है क्या? Now, what is the importance? The importance is going to be in female who is probably anemic, or probably a female who has had gestational diabetes mellitus or over diabetes mellitus. So pre-gestationally, we will always tell them pre-conception counseling में कि तुम्हारा sugar levels reduce करो, otherwise the risk of neural tube defects will be increased. Or females who have come to me, what are the things that I can potentially do for that female before she's pregnant, so that I can avoid all the complications of the disorder that this female has had now in her pregnancy. Also, pre-conceptional part में वो सब बताओगे जो mother को delivery के बाद बताओगे that she should take care of before her next pregnancy. So preconception care is the first point that should be mentioned in your exams. Secondly, once she is pregnant, she has 3 trimesters to look at: first trimester, second trimester, third trimester. These are the 3 phases जिसमें होता है. Now you would think as to why are these trimesters even made? Why couldn't it just be 2 halves of the pregnancy, पहले 20 weeks and the second half of 20 weeks? Why have we done those trimesters? Now there's a significance to that. The first trimester is very classically given to the fetus. Why do I say fetus? क्योंकि इसमें fetus का होता है organogenesis. Till 13 to 15 weeks, the entire organogenesis is completed. So the first trimester is designed in a way or has been stipulated in a way wherein we are giving significance to the fetus, and the fetal changes are what are more important over here. The mother, she is having a few changes that are occurring in her body, but they are not significant enough. So the first trimester is primarily given for the development of the fetus, whereas the second trimester is purely given to the mother. Obviously, the fetus keeps growing, but the organogenesis is done. Now, the only work that the fetus has to have is to increase in size. उसका वजन बढ़ना है. But in the mother, all the major changes, all the physiological changes that occur in her cardiovascular system, that occur in her respiratory system, that occur in her entire body, in her hematological system, all of these are going to occur in the second trimester, which is why all the maternal disorders, the major ones, are diagnosed in the second trimester, be it the preeclampsia का thing or over diabetes, insulin resistance आता है second trimester में, or be it something like RH isoimmunization का chances बढ़ना शुरू होता है second trimester में, anemia because of hemodilution is going to start increasing or is going to start occurring in second trimester. So all the maternal comorbidities are the ones that start occurring in the second trimester. Whereas the third trimester is given to both the mother and the fetus. क्यों? मदर को डिलीवरी के लिए प्रिपेयर करना है. द बॉडी डज नॉट नो दैट देयर इज एन ऑप्शन ऑफ सिजेरियन सेक्शन. द बॉडी का काम इज ओनली टू नो दैट वजाइनल डिलीवरी इस बेबी का कराना है. So the body has to start preparing for that. The cervix, the uterus has to start preparing for that. So there are changes that keep on occurring in the cervix. The cervix softens. The cervix will have changes for it to be able to dilate at the time of delivery. Whereas fetus may, there are changes that will help the baby adapt to outer environment. So the baby now has to be prepared so that it can start leading a life outside the uterus, outside the womb once it is delivered. Which is why the third trimester is for both the mother and fetus. Which is why whenever you state any answer, remember trimester wise क्या क्या significance है, you would remember कि उसमें क्या क्या आंसर में मेंशन करना है. इसके बाद में आता है the period of parturition. Parturition can be a vaginal delivery or it can be a cesarean delivery. उसमें भी अगर डिस्कस करना है तो यू हैव टू आंसर, इफ यू हैव टाइम देन नो दैट लेबर के बारे में बात करना है. लेबर में भी 3 मेजर स्टेजेस है, फर्स्ट, सेकंड एंड थर्ड. फर्स्ट में इट इज टिल द फुल डायलेटेशन ऑफ द सर्विक्स, सेकंड में टिल द बेबी इज डिलीवर्ड एंड थर्ड में द प्लासेंटा इज डिलीवर्ड. सो मेंशन द कॉम्प्लिकेशंस ऑफ ईच इंडिविजुअल स्टेज ऑफ लेबर so that you can elicit or elucidate your answer better. Finally, the last point of discussing a mother is postpartum period में क्या क्या changes आएंगे. So postpartum period में जैसे insulin resistance will reduce, maternal hypertension will start reducing, though in the initial few days there is going to be a spike of blood pressure. Her anemia is going to start getting corrected. Her uterus is going to start involuting. So what are the postpartum changes that can occur? What are the normal postpartum changes like the ones I mentioned? What are the abnormal changes like the female can have puerperal sepsis, there can be surgical site infection. So all these complications can occur. So remember, split your mother का clinical features depending on which trimester she is in, or rather which phase of pregnancy she is in. It can be the preconception period, the first trimester, the second trimester, the third trimester, the period of parturition, and the period that follows after that, that is your postpartum period. Similarly, for the baby, you have to divide it. Obviously, preconception period में तो कोई significance है नहीं. So it is first trimester, second trimester, third trimester, and then its life as a neonate once it is delivered. First trimester में the risk of abortions are increased. The risk of chromosomal aneuploidies are increased. So mention about that. Second trimester में you can mention that the risk of aneuploidies and its detection increases. Third trimester में the baby is going to have issues with growth. उसका growth नहीं होगा. There can be fetal growth restriction or intrauterine growth restriction. There can even be IUFD, worst case scenario. There can be the other end of spectrum, macrosomia हो सकता है. So third trimester में it is all about the growth of the fetus, and finally neonate के लिए it is all about how does the neonate survive after delivery. उसको क्या क्या complications हो सकते हैं डिलीवरी के बाद में, जॉन्डिस हो सकता है, उसको हाइपोग्लाइसीमिया हो सकता है, नियोनेटल सीजर्स हो सकते हैं, को नियोनेटल सेप्सिस हो सकता है. All these things can occur in the neonate after delivery. So the signs and symptoms, the clinical features in your answer have to be defined for the mother and fetus both, depending on which phase of pregnancy they are in. Has everyone understood everything until this point? Does anyone have any doubt? Is everyone understanding everything? We have come halfway through our session on how to write answers on answer writing methodology. Has everyone understood this? Does anyone have any doubt? I'm waiting in the chat section before proceeding. Just taking a 1 minute break. Is this session helping you all? Is this session giving you an idea about the insight that you should have in paper writing, especially in OBGY? Has there been something that you have learned differently from the way you have done till now? Okay, fine. I'll proceed then. Great. I think Vijay Lakshmi has a mic unmuted. If she could just mute it. Fine. I have mentioned all this clinical features में, even the complications are going to form a part. उसको अभी क्या है? That is the signs and symptoms, and also the complications, of course, plus complications. This is what I've discussed until now for clinical features. Fine. Now I have discussed what is the demography of the female. I have discussed what are the risk factors किसमें हो सकता है. I have discussed the pathophysiology. I have discussed the clinical features. I'm done discussing about the disease. Now I need to discuss on what should I be doing to help this female. What is going to be my criteria? What is going to be the way I help this female in improving and getting rid of the disorder? And that is where my management starts. Now, whenever we hear about management, sir, there's a question that we have in the chat. What's the question, sir? If the question is only right over the pathophysiology of preeclampsia, do we have to start our answer with the definition epidemiology? Bushra, that's a good question. Remember, it also depends on whether your answer is a. Bushra is asking कि अगर exam में सिर्फ पूछा रहेगा pathophysiology के बारे में about any disorder, do we still write all this? Bushra, the answer is first of all, see whether it's a long answer or a short answer question. If it's a long answer question, then obviously बात है कि you would have to write everything. Merely the pathophysiology is not going to grant you enough marks. That is very important to understand. Secondly, remember or see what is the status of your time management. Are you having adequate time so that you can even write the peripheral things? Do that. If neither of the answer is yes, I do not have enough time, nor is it a long answer question, then just write about the pathophysiology. Although I would always say for every single question, short answer or long answer, always write the definition. The definition is the first line that you write. It literally gives a comfort zone for you to operate around. कि at least definition इसने लिखा है, मतलब इसको disease का क्या सार है, what is the basis of your what is the basic idea of your disease is what you already know. So always write the definition. Regarding the all other aspects, it depends on whether you have time and whether it's a long or a short answer question. Fine. Now I have to manage this female. Now whenever management begins, every single person, every single answer that I get in the practicals or in the theory booklets that I get, one problem that everyone does is सब लोग directly treatment का बात start करते हैं. अरे remember, मैनेजमेंट इज नॉट जस्ट अबाउट ट्रीटमेंट. मुझे सिर्फ ट्रीट नहीं करना है फीमेल को. ट्रीट तो मतलब ऑब्वियसली करूंगा, बट मैनेजमेंट में इट इज नॉट जस्ट अबाउट treating the female of a disorder. There are two aspects to management: DX and RX. RX is what people focus on and they end up losing marks that they could have scored by also writing about the DX. RX is the treatment, whereas DX is the diagnosis. अरे पहले डायग्नोसिस को कंफर्म तो कर लो. कैसे कंफर्म करोगे? ऑफ कोर्स तुम लोग ने सब कुछ तुम लोग के पैथोफिजियोलॉजी में ये सब लिखा है, बट आई स्टिल नीड टू नो ना, हाउ वुड यू डायग्नोस दिस डिसऑर्डर? डू आई नीड टू डू सम टेस्ट टू डायग्नोस इट? अपार्ट फ्रॉम डायग्नोसिस, I also need to know how severe is the disease, because the disease ka severity, especially in obstetrics, can literally help you know whether you have to terminate the pregnancy or not. So it's a big question that needs to be answered, and that everything is going to be answered by looking at the severity. Also, what if it's something completely different? What if you are looking at a picture of liver function test and it shows everything that is health related? But what if an alternative diagnosis like hepatitis B, viral hepatitis, is something that is not being diagnosed yet? So there can be an alternative diagnosis, or what we also call as a differential diagnosis. ये सब diagnosis के part पे depend करेगा. You cannot start treating the female before confirming the diagnosis. So writing the answer merely about diagnosis के बिना लिखे treatment is completely wrong. Management can never be all about just your treatment. It has to also be about how do you diagnose your illness. So when I talk of diagnosis, I have to do investigations. Now, first thing that you need to ask yourself कि why am I doing an investigation? इन्वेस्टिगेशन करने का क्या जरूरत है? क्लिनिकली मुझे को पता चल रहा है, मैंने पेशेंट का बीपी लिया, प्री क्लैम्पशा है, मेरे को पेशेंट क्लिनिकली पेल लग रही है, अनीमिया है, पॉसिबली हो सकता है, व्हाई नॉट? मैंने पेशेंट का बेबी का एग्जामिनेशन किया एंड आई फेल्ट दिस मैक्रोसोमिया ऑन माय क्लिनिकल एग्जामिनेशन, पॉसिबली शी इज आल्सो ओबीस, सो शी इज हैविंग डायबिटीज मेलाइटिस. देन व्हाई डू आई नीड टू डू इन्वेस्टिगेशंस? Investigations are to help you increase the accuracy of your diagnosis. You just cannot rely on clinical features. So it helps you increase the accuracy, and it helps you know the exact cause, the exact diagnosis pata chalta hai on doing the investigations. It also helps me, as I've mentioned earlier, know how bad your diagnosis is. So complications and severity ka bhi mere ko idea deta hai. So your investigations need to address how to increase the accuracy, how do I do exact diagnosis, how do I look at the complications and severity. इसका क्या मतलब है? I will just tell you in a while. So when I do investigations, I can have two types of investigations. One is where I test the serum of the female, and the other one where I do imaging studies of the female. In serum, I can have multiple serum that I can test. It can be either my commonest thing, blood, it can be my urine, it can be my stools, or it can even be amniotic fluid in cases of chorioamnionitis. ये सब फ्लूइड्स है, बॉडी के प्रोड्यूसर्स है, जो मुझे देखने हैं सीरम के टेस्टिंग में हर एक करके. यही सीरम के टेस्टिंग्स में आई हैव टू लुक फॉर द एबनॉर्मल पैरामीटर्स. When I say the abnormal parameters, what do I intend to say? First, I need to see the general टेस्ट. क्या बोलते हैं जनरल टेस्ट? मतलब क्या होता है? मेरा सीबीसी उसमें आता है, कंप्लीट ब्लड काउंट आता है. बेसिकली इट गिव्स मी ओवरऑल पिक्चर ऑफ हाउ बैड द डिजीज इज. इट कैन आल्सो हैव माय यूरिन रूटीन माइक्रोस्कोपी, उसमें पस सेल्स दिखेंगे. आई वुडंट नो द एग्जैक्ट diagnosis, but I would have an idea of the disease. I would want to know the blood group. I would want to know the viral status, that is triple H, HIV, HBs, HCV. I can do ICT, DCD, Coombs test. So basically मेरे को एक rough idea आ जाता है कि क्या diagnosis हो सकता है. And then I have systemic tests. Basically tests that don't tell me a generalized picture. It can only give me a very specific system ka picture. That can be LFT, that is liver function test, or RFT, that is renal function test, or it can be the coagulation profile. Coagulation profile because I should know whether the female is in DIC or not, or whether there is some infection that this female has. So उसके लिए मैं culture sensitivity भेजना चाहूंगा with drug sensitivity testing. So systemic test करूंगा और general test करूंगा just to know to whether have an overall idea by seeing these general tests, and to know how bad each and individual system is. Doing these tests would let me have an idea about how bad. General test would ideally मेरे को help करेंगे exact diagnosis क्या है पता करने में, and systemic test would help me know कि what are the complications that have occurred and how bad are they. समझ रहे हो तुम लोग? there's a different perspective that you need to have. ऐसे randomly rattling about the name of the test जैसे बोलते जाने का CBC, LFT, RFT, ट्रिपल एच, BGCM ऐसे बोल के नहीं होता है. You need to understand कि why am I doing it? What is the purpose of doing it? The purpose of doing the general test is to confirm the diagnosis, and systemic test is to know how individual target organs are affected, so that I know what are the complications that are occurring and how bad those complications are. That is the significance that is played by general and systemic tests. Next, I have imaging studies. Imaging studies are also going to help me in the accuracy part. Remember, मैंने यहाँ पे बोला था investigations के तीन पर्पस होते हैं, तो उसमें से एग्जैक्ट डायग्नोसिस, कॉम्प्लिकेशन, ये सब तो मुझे पता चल गया ऑन ब्लड टेस्ट. हाउ टू इंक्रीज द एक्यूरेसी? आई कैन इंक्रीज द एक्यूरेसी बाय इमेजिंग स्टडीज. बेसिकली यूएसजी है, मेरे को यूएसजी पे डाउट आ रहा था दैट देयर माइट बी प्लासेंटा अक्रीटा स्पेक्ट्रम, सो मैंने यूएसजी के बाद कंफर्म करने के लिए एमआरआई किया. सो एमआरआई मैंने किया. सिमिलरली मेरे को चेस्ट में एलआरटीआई के सिम्टम्स लग रहे थे, निमोनिया लग रहा था, मैंने चेस्ट एक्सरे किया, मेरे को डाउट था, मैंने हाई रेजोल्यूशन सिटी स्कैन किया. Basically, it helps me increase the accuracy of my imaging. Similarly, I thought there is IUGR. मैंने ultrasound किया to know whether there is adequate growth. नहीं था. To confirm, I did a Doppler as well alongside it. Doppler, always remember, is named after Johann Doppler. He was a scientist. Doppler was the name of a person. It is obviously a phenomena as well. It's a thing as well that you do in ultrasound. But remember, the D has to be capital because it is named after a scientist. So मैंने Doppler किया. So ये सब चीजें मुझे करनी है to know whether the baby is doing well, the mother is doing well or not. So imaging में all these modalities can be done. Obviously, the ones with ionizing radiations are the ones that are preferably avoided to be done during pregnancy. We tend to avoid them, but unless it is very essential, the maternal benefit is always more than the fetal risk, then I would go ahead and do these tests. So this is the significance of doing the investigations, and this is a rough overview of what are the investigations that I shall be doing and why do I do them. The perspective, जो तुम्हारी सोच है आंसर मेकिंग के पीछे, वो ये होनी चाहिए, so that you would be able to find your own answers in the exam. Everyone has read at least one topic. For the ones who have watched Sherlock Holmes of Benedict Cumberbatch, whoever has watched it, they would know that there's a concept that they have shown. It's a fictional concept, I would say, wherein there is something called the mind palace, I think, wherein the protagonist says that in at least some corner of my mind, the thing that I've seen or read at least once, it is stored somewhere. All I have to do is retrieve it. तुम लोग 10 बार भी एक चीज पढ़ के भूल सकते हो और एक बार भी एक चीज पढ़ के याद रख सकते हो. So remember, for whatever things you have read just once, it is stored somewhere in your mind. All you have to do is retrieve it. How do you retrieve it? How can you sharpen your retrieval skills? It is by knowing this algorithm of how and what am I doing with that patient. क्या क्या एक एक स्टेप में मैं आगे करना चाहूंगा जब मेरे पास पेशेंट आता है. दैट वुड ऑटोमेटिकली फेच दी आंसर्स. एक एक करके ड्रॉवर दिमाग के खुलने शुरू होंगे एंड तुम लोगों को फाइनली वो आंसर वाला लिफाफा मिल जाएगा तुम्हारे ही दिमाग में. आगे पीछे कॉपी वॉपी मारने का जरूरत ही नहीं है, कुछ इधर उधर पूछने का जरूरत नहीं है. यू कैन डू इट योरसेल्फ. डू नॉट बी नर्वस. एक बार भी हर एक चीज पढ़ा है, दैट इज एडिक्वेट इनफ फॉर यू टू गेट थ्रू एंड राइट amazing answers. You just need to know how to retrieve it from your mind. So this way of remembering things, this perspective of remembering things is really going to help you all. Finally, coming to how do I manage, how do I treat, I'll just write the treatment wala part below. Management, treatment. Now treatment mein I can have various ways of managing. The first one can be conservative management. Conservative yani wait and watch. Second होगा मेरा मेडिकल मैनेजमेंट. मेडिकल यानी दवाई से ठीक हो रहा है या फिर फार्माकोलॉजिकल भी बोल सकते हो. एंड लास्टली वुड बी आई हैव नो अल्टरनेटिव बट टू जस्ट डू अ सर्जरी. व्हेन आई टॉक ऑफ सर्जरी, स्पेशली इन अ गायनेक पेशेंट, surgeries can either be conservative surgeries wherein I'm saving the organ intends to be here, the conservative surgery intends to be the uterus, or they can be radical or extirpative. Extirpative is basically सब कुछ उखाड़ के निकाल देना है. Extirpative surgeries. So I have to see whether a conservative surgery is required or a radical surgery. How would you determine that? सबसे important determinant एक ही रहेगा, उसका age क्या है. If it's a younger female, you would want to do a conservative surgery. मैलिग्नेंसी है कि नहीं देखना चाहोगे. मैलिग्नेंसी अगर है तो रेडिकल ऑब्वियसली करना चाहोगे. दीज टू फैक्टर्स आर गोइंग टू डिटरमाइन व्हाट इज द काइंड ऑफ सर्जरी दैट यू वांट टू डू ऑन डिसाइडिंग क्या करना है. इन ऑब्स्टेट्रिक्स सर्जरी मतलब टर्मिनेशन ऑफ प्रेगनेंसी करना है तो वजनरी करना है कि एलएसईएस करना है. If I'm talking about LCS or if I'm talking about any surgery, there has to be a good enough indication. So what is the indication for doing the surgery? Remember, whenever you undertake any procedure in any department, it can be an incision drainage of a breast abscess in surgery, or amputation in orthopedics, or something like LSES in OBGY. Every single surgery that you do will have its own set of complications, will have its own set of medical legal repercussions. So whenever you decide to undertake any minor ho ya major ho surgery, all the complications should be justified कि तुमने ये procedure किया ही क्यों. मेरा मूड था आज सुबह इसलिए मैंने सिजेरियन किया, ऐसे नहीं चलता है. Everything needs to have an indication, and that indication is what can justify कि तुमने वो सर्जरी क्यों किया है. So whenever you're talking about termination of pregnancy, LSCS करना है, always remember that you have to state an indication. You have a patient with eclampsia. They ask you कि एग्जाम में क्या करोगे टर्मिनेशन के लिए. You say LSCS. Absolutely wrong. इक्लैम्शिया क्यों हो रहा है? क्योंकि तुम्हारा बीपी बढ़ा हुआ है. बीपी क्यों बढ़ा हुआ है? क्योंकि तुम्हारे बॉडी में प्लासेंटा है. प्लासेंटा से जो सोल्यूबल एफएमएस लाइक टायरोसिन काइनेज एंड सोल्यूबल एंडोग्लाइन निकल रहा है, दैट इज द प्रॉब्लम. व्हेन यू रिमूव द प्लासेंटा, बॉडी से ये निकल जाएंगे, बट the soluble endoglyne and soluble FMS like tyrosine kinase that is already present in your body has its own half life. That is not going to be removed immediately after the placenta is removed. वो आराम से 3-4 दिन बाद जाएगा पूरी तरह से बॉडी से. So by doing an LACS for a female with eclampsia, her eclampsia is not going to get cured. Those inciting agents, factors are still in her body, which is why you need to be able to justify क्यों cesarean कर रहे हो. There was some obstetric indication like previous 2 LACS या फिर CPD, that is cephalopelvic disproportion, या फिर abruptio placentae, then you can justify doing a cesarean section in patient with eclampsia, but not otherwise. This is just an example for you to know how do we decide on the indication. You just say कि एक 30-year-old female मेरे पास आई है प्रोलैप्स लेके, उसका प्रोलैप्स था, मैंने हिस्टेक्टमी कर दिया. अरे 30-year-old फीमेल का तुमने हिस्टेक्टमी किया, तुम लोग को पूछते क्यों किया, तुम बोलते हो कि उसका 3 बच्चा घर पे था, हो गया है. अरे बट child bearing is not the only function of the uterus. Remember, whenever you remove the uterus, the blood supply to the ovaries are also impaired slightly, and studies have shown that within the next 4 or 5 years, the female will have start having symptoms of menopause, of estrogen deficiency. So whenever you're doing a hysterectomy, remember that in the next 4 or 5 years, even the ovaries are going to get necrosed, and that female will start having those symptoms of menopause like osteoporosis, mood swings, night sweats at the age of 35, 36. Not justified. It is not right. Which is why you need to be able to justify every single surgery that you do for your women, irrespective of whatever you think. Justification अगर है, वो indication बनता है. मेडिकल मैनेजमेंट में क्या क्या? मेडिकल मैनेजमेंट में सिमिलरली जैसे मैंने इन्वेस्टिगेशन में किया था, जनरल सिम्टम्स को देने के लिए, कम करने के लिए मैं कुछ मेडिसिन दूंगा, और कुछ स्पेसिफिक चीजों को मैं कम करने के लिए मेडिसिन दूंगा. जनरल सिम्टम्स क्या होते हैं? अगर फीवर है, कफ है, कोल्ड है, ये सब के लिए मैं जनरल मेडिसिन दूंगा. फिर स्पेसिफिक मतलब क्या? एंटी हाइपरटेंसिव्स और इंसुलिन फॉर डायबिटीज मेलाइटस, मेटफॉर्मिन. अनीमिया के लिए पैरेंटल आयन या फिर ओरल आयन, या फिर RH नेगेटिव प्रेगनेंसी के लिए यू वुड वांट टू गिव एंटी डी. सो स्पेसिफिक मेडिसिन. Whenever you speak of any of the medicines that you're giving, pharmacological में, you have to remember to write a few things. First of all is dose. कितनी बार दिन में दोगे और कितना डोज दोगे? How much and how many times? Two questions that need to be answered here. Secondly, what are the complications that might occur by giving this medicine? कॉम्प्लिकेशन मतलब साइड इफेक्ट से जो हो सकता है, या फिर एक डोज एक्सेस हो गया तो टॉक्सिसिटी से. वेरी क्लासिकल एग्जांपल इज मैग्नीशियम सल्फेट दैट यू गिव फॉर इक्लैम्शिया. साइड इफेक्ट्स क्या है? रेस्पिरेटरी डिप्रेशन है, फीमेल विल हैव रिड्यूस्ड यूरिन आउटपुट. ऑल दीस थिंग्स कैन हैपन. टॉक्सिसिटी होगा तो क्या करोगे? क्या करोगे? कॉम्प्लिकेशन को मैनेज कैसे करोगे? मैनेजमेंट क्या है कॉम्प्लिकेशंस का, वो भी बताओगे. इसमें जैसे कैल्शियम ग्लूकोनेट तुम दोगे. एंड वेदर देयर आर अल्टरनेट थेरेपीज दैट आर अवेलेबल. Alternative therapies मतलब तुम लोगों ने बोला है कि labetalol is one of the most commonly given dosages for hypertension in pregnancy. The alternative is nifedipine that you can also give to the female. या फिर अनीमिया में parental iron के लिए क्या क्या अलग अलग salts आते हैं, oral iron के लिए क्या क्या अलग अलग salts आते हैं. So also mention the alternative therapies, medical therapies that you have available with you, and that is how you would be treating your female, your patient. Did everyone understand? We have just finished the second agenda for the day. Saloni has asked a question, sir, to come to the diagnosis. Do we need to take a proper history, or should we write important and positive points only related to history? Regarding exam case taking, I'm going to discuss it tomorrow, Saloni. So I would rather recommend that I would discuss on that tomorrow, because it's an entire topic in itself. We are done with our two agendas. The first one being how to write the answers, and the second one being what to write in the answers. In your theory exam, you need to take proper history. Just mention the positive points जो history पे female देगी. The positive points are going to be your symptoms, maternal symptoms in each trimester. So definitely you would be writing it. Negative points you preferably don't write unless you are trying to answer a question which states कि mention the differential diagnosis as well. तो अगर differential diagnosis का पूछा है तो क्या क्या होगा उसमें, negative history से वो पता चलेगा. That's it. So the final point, the final part of the exam is what are the most important previous year's questions जो बहुत ही अगर hopeless situation में हो तुम, hopeless situation मतलब कुछ भी नहीं पढ़ा है due to some illness or something that you have not been able to read, तो at least क्या पढ़ के जाऊँ ताकि मैं एग्जाम में पास हो जाऊं. And if you have read everything, then what should I be revising on the last day, which I'm pretty sure exam mein aayega hi. So I have made a set of, there are around 150 to 175 questions each in obs and gynae that are coming. मैंने उसमें से around 20-25 questions from each निकाले हैं जो previous year questions में आए हुए ही है और आते ही रहेंगे. I'll be making a list of it in the next 5 minutes, but before I go for it, please let me know, does anyone have any doubt whatsoever until now? Everyone, I'm just waiting for you all in the chat. Has everyone understood everything that we have spoken until now over the last 1.5 hours? Akshata, again, a similar answer that I gave for um, I just gave for the previous one. If a clinical based question is asked, let us assume a clinical question ऐसा पूछा गया है कि there's a female who's 60-year-old, 60-year-old female है, 60 नहीं, 70-year-old female है, who's having grade 3 uterine prolapse. She's also known case of ischemic heart disease and has a history of ischemic stroke. So what would you do for her? So it's a clinical question and they have asked for the diagnosis. Should we write and give the justification? Again, it depends on what your answer ka type is. If it's a long answer, then you would write the differentials and the different managements that you can offer along with the description of the surgeries that you can do. If it's a short answer, just mention the name of the surgeries that you can do and one common justification. For example, the answer for this question, this clinical scenario that I just stated would be that given that it's a female with several high risk factors and she's very elderly, I would want to do a procedure which is vaginal obliteration, which we also call as a left foot scalpoclysis, because she cannot withstand the anesthesia and the surgical stress that would arise for her. So in that way, you can just answer in a short answer question. Whereas you would discuss all the possible options like vaginal hysterectomy, pessary, left foot scalpoclysis in a long answer, and then justify why are you preferring left foot scalpoclysis if you're answering a long answer question. Sir, is the question has a clinical scenario and right approach? Should we start with history examination or directly with investigations? If they have asked an approach for management, then in that scenario, तुम लोग सिर्फ management का part लिखो, but just define कि क्या है, and एक line में clinical symptoms लिखो that the female will have urge incontinence, urinary incontinence जैसे चीजें उसको हो सकती है, fecal incontinence हो सकता है, discomfort होगा, there will be ulcers that come for the same question that I'm mentioning. And then go ahead with the management part with investigations कुछ करोगे क्या, and what are the possible surgeries, what are the possible drugs that you can give to them. So when you are asked about an approach, define करो, clinical symptoms एक line में बताओ, and then focus more on the management part. Is it is necessary to remember the dose of every inter? I don't know if that's your actual name. It is necessary. Yes, it is necessary for important drugs because बहुत कम drugs है OBGYN में जो बहुत important है. Things like labetalol. Labetalol. I'm going to discuss. By the way, I'm going to discuss about the drugs and how to answer about drugs tomorrow. But just to give you a brief overview, yes, absolutely, you do need to remember, क्योंकि अपने doses है, drugs है ही कितने सारे हम यूज करते हैं, Labetalol यूज करते हैं, Nifedipine यूज करते हैं, मैग्नीशियम सल्फेट यूज करते हैं, फिर डायबिटिक्स के लिए मेटफॉर्मिन यूज करते हैं, अनीमिया के लिए अपना फिक्स्ड रेजिमेन है जो गवर्नमेंट ऑफ इंडिया ने रिकमेंड किया है कि आयरन दिन में 60 मिलीग्राम एलिमेंटल आयरन देना है. सो अपने पास है ही 8-10 ड्रग्स मेन. So definitely you need to remember the dose of each and every drug. Obviously, you don't need to remember the name of the antibiotics and the dose that you need to give, but only for the important drugs, and that too in obstetrics you need to remember, because obstetrics mein there is a fetal risk that is included due to those drugs. So obstetrics mein yes, gynae mein no. Infections ke liye antibiotics, just state the names, do not write the dose of it. But obs mein major drugs, yes, you have to write. यस एब्सोल्युटली. हेवी मेंस्ट्रुअल ब्लीडिंग अगर पूछा गया है तो शॉर्ट आंसर अगर रहेगा तो मैं पाम कॉइन क्लासिफिकेशन लिखूंगा, बट एक एक को डिफाइन नहीं करूंगा. आई वुड वांट टू सी कि उन्होंने हेवी मेंस्ट्रुअल ब्लीडिंग के साथ पेशेंट का डेमोग्राफिक्स क्या दिया है, व्हाट इज माय मोस्ट लाइकली. अगर शॉर्ट आंसर क्वेश्चन है तो व्हाट इज माय मोस्ट लाइकली डायग्नोसिस, और उसको मैं पूरी तरह से डिफाइन करूंगा. दे विल गिव सम हिंट अबाउट द डेमोग्राफिक्स ऑफ द पेशेंट. Whereas if it's a long answer question, then I have to write everything. सब पे थोड़ा 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 मुझे लिखना ही है. सबको इन्वेस्टिगेट कैसे करके, कंफर्म कैसे करके मैनेज करूंगा, हर एक का लिखना जरूरी रहेगा. So it depends again on how many marks that it has been asked for, but definitely the classification, at least the names, I would want to mention even for a short answer question. So should we proceed? Yes, they do ask about the theories. Absolutely, theories बहुत important है यार. मैं अभी बताता हूँ तुम लोगों को कौन से सर्जरीज पूछने वाले, बट yes, they do ask about surgeries. They don't ask you how to do it at the level of undergraduation. They do ask about कौन से सर्जरीज करने हैं. पोस्ट ग्रेजुएशन में they do also ask about कैसे करने हैं, but the names of the surgeries what are there, the name of the surgeries are essential for you to know. कौन से सर्जरीज है पता रहना जरूरी है. They do ask about surgeries in theory. They do not ask you how it is done because they don't expect that you would know the steps. So then I'll just proceed with the final part wherein I'm telling you all about the essential questions, the very important questions that would come. Fine. Then the last session, the last point. Can you mention? अरे I'm going to mention for MBBS only. आज मैं भी जो भी क्वेश्चन बताने वाला हूँ वो MBBS के लिए बताऊंगा. पीजी के लिए मैं कोई क्वेश्चन नहीं बताऊंगा क्योंकि कोई भी क्वेश्चन कभी भी आ सकता है. पूरा का पूरा प्रीवियस ईयर क्वेश्चन करके जाओ, रैंडमली कुछ भी पूछ सकते हैं. So what I'm going to discuss now are strictly undergraduation वाले previous year के questions. So starting with obstetrics, I'm just going to make a list of it. तुम लोग quickly list बना लो इसकी भी. I thought I would do it orally, but I think it would be better if I just jot it down. So the first question that is asked very commonly, I'll go trimester wise mostly, placenta and its functions. Very commonly asked. When this is asked, you would be writing about how the placenta is formed right from the first trimester and what are the functions, hormonal functions, synthesis functions, metabolic functions, excretory functions. Also, you would be writing about, अगर especially LAQ आया है, तो what are the complications of placenta? Complications of placenta like abruptio placentae, placenta previa, and सबसे important, preeclampsia. So placenta and its functions. Secondly, physiological changes in pregnancy. एंड फिजियोलॉजिकल चेंजेस में भी सबसे इंपॉर्टेंट जो पढ़ना ही है इज सीवीएस में क्या क्या चेंजेस आते हैं. सबसे इंपॉर्टेंट है कार्डियोवास्कुलर चेंजेस में. रिमेंबर देयर इज कार्डियो एंड देयर इज वैस्कुलर. इट इज नॉट जस्ट कार्डियो, डोंट फॉरगेट दैट. तो कार्डियो में हार्ट में क्या क्या चेंजेस आएंगे और वेसल्स में क्या आएंगे. हार्ट में देयर इज गोइंग टू बी कॉन्सेंट्रिक हाइपरट्रोफी होगा हार्ट का. देयर इज गोइंग टू बी लेफ्ट एक्सिस डेविएशन. देयर इज गोइंग टू बी स्लाइट शिफ्टिंग ऑफ द हार्ट बिकॉज ऑफ द ग्रेविटी यूट्रस. Apart from that, कौन से murmurs सुनाई देंगे physiological and pathologically. Diastolic murmurs are going to be pathological. So always remember physiological में physiological में mention करो थोड़ा बहुत. अगर time है तो एक दो pathological changes भी लिखो. Vascular में you also have to answer about how the heart rate increases by 10 beats per minute in the second trimester. You have to mention about how there is hemodilution. 50% से plasma बढ़ता है, but only 25-30% से 20 to 25% से red blood cells बढ़ते हैं, जिसका से cardiac output भी बढ़ता है. So all those things are to be written. CVS में physiological changes in pregnancy. The next very important question जो आता ही है almost हर एक question हर एक exam में, that is NST, BPP and modified BPP. पढ़ के ही जाना है, लाइन बाय लाइन पढ़ के जाना है. There is no escape from this. Very important. एग्जाम में भी तुम लोग को ये क्वेश्चन पूछेंगे प्रैक्टिकल एग्जाम में. नेक्स्ट, stages of labor and especially stages of labor में they ask the question on third stage of labor. Third stage of labor is basically placental expulsion वाला stage. उसमें active management में क्या करेंगे? What are the pathological things that can happen, like retention of the placenta, atonic postpartum hemorrhage, genital trauma, that is traumatic PPH. तो ये सब third stage में होता है after the delivery of the placenta or around the time of delivery of placenta. Especially active management of AMTSL, third stage of labor. वो लिखना बहुत जरूरी है. नेक्स्ट इंपॉर्टेंट क्वेश्चन इज गोइंग टू बी हाइपरेमेसिस ग्रेविडारम पे आएगा. हाइपरेमेसिस ग्रेविडारम फर्स्ट ट्राइमेस्टर में कॉमनली होता है, 16 वीक्स तक मैक्सिमम होता है. उसके बाद में इट स्टार्ट्स रिड्यूसिंग. इट हैज अ लॉट टू डू विद सेवरल हार्मोन्स इन द बॉडी, स्पेशली बीटा एचसीजी, ह्यूमन प्लासेंटा लैक्टोजन, ईस्ट्रोजन, प्रोजेस्टेरॉन, कॉर्टिकोस्टेरॉइड्स, ऑल दीज हार्मोन्स वेरी इंपॉर्टेंट. कैसे ट्रीट करोगे? फ्लूइड रेस्ट्रिक्ट थोड़ा करना पड़ता है. देयर इज कीटोसिस दैट हैपेंस. तो स्टारवेशन कीटोसिस को कैसे ट्रीट करोगे? व्हाट आर द थेरेपीज दैट वी हैव अवेलेबल, द मेडिकल थेरेपीज, and the final therapy obviously being termination of pregnancy, last ditch effort. नेक्स्ट, अबॉर्शंस पे बहुत क्वेश्चंस आते हैं, स्पेशली मिस्ड अबॉर्शन का क्या डायग्नोस्टिक क्राइटेरिया है विद एंड विदाउट फीटल पोल एंड कार्डियक एक्टिविटी. नेक्स्ट, एक्टोपिक प्रेगनेंसी पे आते हैं क्वेश्चंस. एक्टोपिक प्रेगनेंसी की जब मैं बात करता हूं तो उसमें मेडिकल मैनेजमेंट के ऊपर बहुत फोकस करना है. ऑल द सुटेबिलिटी पेशेंट क्राइटेरिया लिखने हैं मेडिकल मैनेजमेंट के लिए. तो मेडिकल मैनेजमेंट ऑफ एक्टोपिक प्रेगनेंसी वेरी इंपॉर्टेंट. अपार्ट फ्रॉम दैट नेक्स्ट आता है, आई जस्ट या प्री क्लैम्शा. प्री क्लैम्शा में क्लिनिकल पिक्चर देंगे तुम्हें कि 30-year-old फीमेल है, at 30 weeks of gestation she is having severe preeclampsia or she has eclampsia. what do you do? तो टर्मिनेशन करना है कि नहीं करना है, मैनेजमेंट कैसे करोगे, सब कुछ लिखना जरूरी है. पैथोफिजियोलॉजी मैनेजमेंट, ड्रग्स कौन से दोगे, मैक्सिमम डोज कितना दोगे, टर्मिनेशन करोगे तो कैसे करोगे, सिजेरियन कब करोगे, ऑल दीज थिंग्स वेरी इंपॉर्टेंट. प्री क्लैम्शा वन ऑफ द मोस्ट इंपॉर्टेंट क्वेश्चंस. आई जस्ट मार्केट विथ रेड की दो सबसे इंपॉर्टेंट क्वेश्चंस कौन से अब तक आए हैं, एनएसटी एंड प्री क्लैम्शा एंड थर्ड स्टेज. ये तीन बहुत ही इंपॉर्टेंट क्वेश्चंस है. नेक्स्ट आता है एब्रप्शो प्लासेंटे. बेसिकली एवरीथिंग रिलेटेड टू द प्लासेंटा एंड इट्स पैथोलॉजी. प्लासेंटा एंड इट्स पैथोलॉजी में आता है एब्रप्शो एंड प्रीविया. मेनली इतना ही पूछेंगे, एब्रप्शो एंड प्रीविया. नेक्स्ट आई जस्ट राइट इट ऑन दिस साइड नाउ सो दैट एक पेज के अंदर सब आ सकेगा. पीछे यहाँ पे लिखता हूँ. HIV इन प्रेगनेंसी बहुत कॉमनली पूछेंगे तुम्हें. उसके बाद में प्रीटर्म लेबर, अगेन रेड मार्क क्वेश्चन, रेड मार्क क्वेश्चन. प्रीटर्म लेबर पूछेंगे तुम लोग को. प्रीटर्म लेबर में दे विल आस्क यू सबसे इंपॉर्टेंटली नियोनेट पे क्या लफड़ा होता है, नियोनेट में क्या प्रॉब्लम होगा, नियोनेटल problems क्या होंगे, how would you treat, how would you manage preterm labor, all these things are also going to be important. They are going to be asked. How would you manage tocolysis, steroid cover कैसे दोगे, all these things very important. preterm labor again a red mark question. I have marked it red mark, मतलब एग्जाम में definitely आएगा. You have to study and go for that. You have to also read about all the neonatal complications that might occur in these women. Next, there will be questions on, just a moment, I think there's some glitch. Yeah. Yeah. So After preterm labor, what are the various questions so they can ask in preterm labor? It can be the causes of preterm labor, infectious causes, cervical insufficiency. They would ask you the treatment. Treatment में तुम लोग क्या क्या लिखोगे? Cervical insufficiency है तो सर्कलाज कौन से टाइप का करना चाहोगे? अपार्ट फ्रॉम दैट सर्कलाज के बाद में तुम बताओगे कि मैनेजमेंट पे टोकोलिसिस कैसे दोगे, स्टेरॉइड कवर कैसे दोगे, एंटीबायोटिक कवर देना है या नहीं, वो सब बात करना है तुम्हें. वेरी इंपॉर्टेंट क्वेश्चन, प्रीटर्म लेबर एंड द neonatal complications as well. Next, the important question that will be asked is going to be on forceps, more important for practicals, but indications and prerequisites. ये पूछेंगे तुम्हें in your theory exams. Again, a red mark question, RH isoimmunization, that is anti-D related questions, RH isoimmunization, RH negative pregnancy, basically very important question. बहुत बार पूछेंगे. It is also an important exam case. Next, partogram, they are asking a lot about it. Remember, partogram बहुत सारे आ चुके हैं. The latest one is 2021 में जो आया है WHO का लेबर केयर गाइड, LCG हम बोलते हैं उसको, वो पूछेंगे. 1994 का जो यूजुअल WHO वाला पार्टोग्राम है वो भी पूछेंगे. दोनों पढ़ के जाना है, बहुत इंपॉर्टेंट है. नेक्स्ट, बचा हुआ पार्ट, नियोनेटोलॉजी में क्या क्या पूछेंगे. नियोनेटोलॉजी में तो बहुत कॉमन क्वेश्चंस है, बहुत लिमिटेड क्वेश्चंस है, बट दे विल कीप ऑन रिकरिंग एवरी टाइम यू गो फॉर एन एग्जाम. किफल हेमाटोमा इज वन ऑफ देम. Neonatal resuscitation, very important, पूछने ही वाले हैं. Neonatal jaundice, again very important, I believe even in pediatrics this is a question. Neonatal jaundice. अबगार बहुत ही ज्यादा इंपॉर्टेंट, अबगार स्कोर के बारे में पूछेंगे. एंड that is it. These 4 questions very common. I'm not saying that other questions won't be asked. These are the more common questions that are going to be asked. कुछ भी नहीं पढ़ा है तो ये पढ़ना है, और अगर क्या पढ़े पता नहीं है लास्ट डे पे तो ये सब क्वेश्चंस पढ़ के जाने हैं. This is for obstetrics. Coming to gynae. गायनी में इंपॉर्टेंट क्वेश्चन सबसे पहले आएगा हार्मोन रिप्लेसमेंट थेरेपी पे आएगा. हार्मोन रिप्लेसमेंट थेरेपी पे काफी बार क्वेश्चन आते हैं. यू हैव टू राइट अबाउट द रोल ऑफ ईस्ट्रोजन, प्रोजेस्टेरोन किस किस में देना है वो बात करनी है. देन यू हैव टू टॉक अबाउट मेंस्ट्रुअल रेगुलेशन, विच इज बेसिकली 6 वीक्स तक के पेशेंट का एमटीपी कैसे करोगे. सो मेंस्ट्रुअल रेगुलेशन. फिजियोलॉजी ऑफ मेंस्ट्रुएशन भी इसमें ही आएगा. सो फिजियोलॉजी ऑफ मेंसेस, वेरी इंपॉर्टेंट, रेड मार्क क्वेश्चन. Next, the question that is going to be asked is very commonly nowadays being asked is about colposcopy. Colposcopy is basically examination of the colpus, that is vagina and the cervix under a camera. Then pap smear, a very important question. Again, pap smear में you have to even mention ऊपर से, not the entire thing. Bethesda classification क्या है, ऊपर से mention करना है तुम्हें. Genital tuberculosis, a red mark question. Genital tuberculosis, primary, secondary, कैसे आता है, HSG पे क्या क्या changes आते हैं, ये सब बताना जरूरी है. Next, you have questions on acute PID. Very important, acute PID. Vaginal infections, very, very important. Vaginal infections, you have 3 infections: bacterial vaginosis, candida, and you have trichomonas. So red mark तीनों को मैं करने वाला हूँ क्योंकि तीनों बहुत बार पूछे गए हैं. Especially bacterial vaginosis, they will ask you Amsel's criteria, they will ask you what is Nugent's score. Bacterial vaginosis definitely पढ़ के जाना है, बिना भूले पढ़ना है. The organisms you have to mention and the drugs that you give has to be mentioned. उसके बाद में abnormal uterine bleeding बताना है. Puberty menorrhagia, again very important questions. Puberty menorrhagia mostly because of coagulation defects, but AUB again a red mark question. palm coin classification पूरा बताना है. palm coin में हर एक का diagnosis कैसे करोगे and manage कैसे करोगे, medically and surgically बताना है. Last सबसे important questions, cancer and prolapse. Uterine prolapse, very important. Uterine prolapse में there can be 2 questions. Young females जिसमें sling surgeries and Manchester Fothergill करोगे, and old patients. So I've discussed these surgeries on my YouTube page, you can watch it. Uterine prolapse and young and old में female में देखना है. Next question, हमेशा by the way इसमें थर्ड ग्रेड ही पूछेंगे, सेकंड एंड फर्स्ट ग्रेड कोई नहीं पूछेगा. तो थर्ड ग्रेड यूट्राइन प्रोलैप्स, यंग एंड ओल्ड डेफिनेटली पूछेंगे. उसके बाद में इनफर्टिलिटी, ओव्यूलेशन. ओव्यूलेशन मतलब ओवेरियन फैक्टर ऑफ इनफर्टिलिटी, हाउ डू यू डायग्नोस इट. ओवेरियन फैक्टर इनफर्टिलिटी, उसमें डायग्नोसिस कैसे करोगे एंड ट्रीट कैसे करोगे. तो टेस्ट फॉर ओव्यूलेशन एंड ट्रीटमेंट ऑफ एन ओव्यूलेशन. Semen analysis. Semen analysis, remember there is an update that has been given in 2021. WHO का एक नया फाइंडिंग्स आया है, नया रीडिंग्स आया है, वो तुम्हें याद रखना है. जस्ट मेंशन सब क्राइटेरिया याद रखना है. मोटिलिटी, मॉर्फोलॉजी, वाइटलिटी, कंसंट्रेशन, वॉल्यूम, पीएच, ये सब इंपॉर्टेंट क्राइटेरिया याद रखना है. नेक्स्ट, फाइब्रॉइड्स पूछेंगे तुम्हें. फाइब्रॉइड्स के बारे में यू हैव टू राइट अबाउट द मैनेजमेंट ऑफ फाइब्रॉइड्स. मैनेजमेंट ऑफ फाइब्रॉइड्स के बाद में you have to also write about management में medical management and surgical management. Surgical management में conservative management का भी बात करोगे and radical, that is hysterectomy वाला भी तुम लोग बात करोगे. Finally, coming to tumors, dermoid cyst, a red mark question. red mark मतलब बहुत ही important है, बहुत बार पूछा गया है. टेराटोमा भी उसका नाम क्वेश्चन की तरह आ सकता है. सो डर्मोइड सिस्ट इज ऑफन गोइंग टू बी आस्क्ड इन योर एग्जाम्स. उसके बाद में कार्सिनोमा सर्विक्स, सीए सर्विक्स, वेरी 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 इंपॉर्टेंट. तुम लोग पूछोगे कैसे याद रखना है, कैसे याद रखना है. फॉर अ डिफरेंट सेशन 2018 का फीगो क्लासिफिकेशन याद रखना है. इसके लिए सीए सर्विक्स बहुत बार पूछा है. वेरी इंपॉर्टेंट, अगेन मल्टीपल टाइम्स फेवरेट एलएक्यू है. हेडेक फॉर a lot of students. Immediately after that, CA endometrium, again a red mark question. Finally, coming down more, there is a question that you will be asked about cryptomenorrhea. Very commonly asked. Cryptomenorrhea, basically imperforate hymen and transverse vaginal septum. Lastly, contraception. Contraception में emergency contraception, favorite question. You have to talk about LNG and copper T mainly. इमरजेंसी कॉन्ट्रासेप्शन पूछा, ट्यूबल लाइगेशन पूछा, बैरियर कॉन्ट्रासेप्टिव, डीएमपीए के ऊपर क्वेश्चंस आते हैं, ओसी पिल्स के ऊपर क्वेश्चंस आते हैं. ऑल आर वेरी इंपॉर्टेंट, दे आर रिपीटेड अगेन एंड अगेन. फाइनली लास्ट, एकदम लास्ट में आता है हर्सुटिज्म. हर्सुटिज्म वेरी कॉमन, एंड पोस्ट मेनोपॉजल ब्लीडिंग एंड इट्स इवैल्यूएशन. So these are all the important questions that you will be asked. Miscellaneous में MTP Act asked very often. 2021 का amendment सबको याद रखना है. There is no escape from that. So these are all the important questions that are asked and have a very high likelihood. I've set the paper for a few times in the preliminary exams, and these are often the commonest questions that even our faculty has put it. So yes, these are all the questions that you need to be studying for gynec and obstetrics. So that is it from today's session. I hope everyone has been benefited from this session. If you all want, I can just send a picture of the number, of the name of the questions. I have just jotted it down on a paper. But that's it. Thank you so much, everyone. Does anyone have any doubt at this point? Has everyone understood this session? Has everyone benefited from this session today? There's a feedback form that we shall be giving. Our team from SIMSOG are going to give you all, or are going to tell you all about the feedback form. But has everyone benefited from this session?
Thank you so much, sir, for such an enriching and a fulfilling session.
Thank you so much.
It was a great
Thank you so
session.
much, and thank you so much for this opportunity. Of course, we'll be meeting tomorrow as well. But yes, it was fun, and the attendance was amazing. Everyone was interactive, everyone was attentive, and that is all I sought as someone who was taking the session. So thank you so much, and good night, everyone.
Sir, we have some questions in the chat box.
Okay, I'll answer. Gagan is asking for prolapse. Do we also have to write about procedure as well for the long answer? Yes, for prolapse, you have to write about the procedure. Not कैसे करते हैं, but कौन से procedures है. Anterior compartment के लिए क्या करोगे? What would you do for the posterior compartment? What would you do for the apical compartment? Just mention the name of the surgery. Just write a couple of lines at the principle of the surgery as to why are you doing that surgery. That's it. Don't write the essentials कि ये suture material use होगा, ये ऐसा stitch लेंगे, vertical mattress लेंगे, वो सब मत बोलो. Just write the principle of that surgery. Write about क्यों antiversion maintain करना है, कैसे करेंगे antiversion maintain, ये सब बात करना है. What are the questions in management? Do we need to know first stage about second stage, like for first stage NPO? Yes, in management, ये देख, तेरे को Devansh has asked a question. In management, do we need to write about first stage of labor, second stage, and third stage? For example, for first stage, nil per oral ambulation. Remember, all this is very much more important if you're writing an exam for MS at the level of MS. तुम लोग के level पे it is not expected. First stage, second stage, and third stage is only significant in a few topics like heart disease in pregnancy, wherein you have to take care of the fluid overload, or something like HIV in pregnancy, wherein you delay doing artificial rupture of membranes. You avoid repeated vaginal examinations regarding the delayed or early cord clamping. So only in these couple of topics you are expected to write everything about first and second stage and whether you have to keep the patient nil by oral, ambulation, anal जैसे कैसे करना है. Otherwise at your level, absolutely not. Active management of third stage of labor में सब कुछ mention करना है, हर एक चीज mention करना है. Can you share the YouTube channel name, please? Yeah, it is by my same name, Dr. Aditya Nimbkar, OBGYN Masterclass. I take free sessions over there. What is the? Yeah, I think I've answered all the questions, team. Then I think we can end the session. It's almost midnight, so we can get done with today's session. We shall meet again tomorrow. If anyone has any doubts in today's session, in the recordings, then they can ask me tomorrow as well. Okay? Yeah, so we
Yes,
have
thank you,
posted
sir.
the feedback form. Everyone, please fill it, and that would be great. Would love to know your reviews on the session. It was an amazing session, and I hope it has benefited everyone. So thank you, Team SIMSOG, and we shall meet tomorrow again. Good night. Good night, everyone. Good night, students. I'll log out.
Yes, sir. Thank you,
Okay.
sir.
Yeah.
Can
Thank you. Good
we
night.
have everybody on video for a picture, if that's all right?
Yeah, absolutely. Works for me. I don't have a camera right now. I just turned it off. You can take a picture of everyone. That would be great.
Okay, if whoever's okay with turning on their videos for a picture, if you're good. Yeah, I think we can end the session. Thank you. We'll see you all tomorrow. Have a good night.